Good afternoon, C-Suite. I know we're all busy, so I'm grateful for the few minutes that we'll have together today so that I can introduce my proposal for the telehealth monitoring application. The strategic enterprise-wide goals we've all been working to achieve include reducing overall costs by 10% and improving physician-based wellness metrics by 20%. In order to do this, we're looking to simultaneously implement 6 projects. One of those, within this large-scale program, is the implementation of a telehealth monitoring application. Let's make sure we're all on the same page and understand what TMA is. The Center for Connected Health Policy, or CCHP, which is run by the Office for the Advancement of Telehealth, Health Resources and Service Administration, and is a division of the United States Department of Health and Human Services, defines telehealth monitoring as the ability to use digital health tools to collect and transmit data to a health facility for evaluation. Telehealth monitoring is sometimes referred to as remote patient monitoring. Regardless of what we call it, it makes good business sense to implement a project where the patient has the ability to monitor their health in their own home, for example, and have that data transmitted automatically to the physician. Telehealth monitoring programs collect a wide range of data, including vital signs, blood pressure, weight, BMI, blood glucose levels, and can even track physical activity, like the number of steps walked each day and how many minutes of moderate or vigorous activity is completed in a week. With the ubiquitous nature of mobile phones, 96% of Americans have a cell phone, and 81% of those are smartphones. It makes sense to utilize the Bring Your Own Device apps that are already on the market and gather as much of that data as possible. The CCHP goes on to suggest that implementing an RPM system can improve diagnostic accuracy by as much as 120%. Utilizing data gathered from the telehealth monitoring application and transmitting it to the practice management system Clinical will allow a provider to monitor these patients between visits and make immediate course corrections to their care plans. These efforts will contribute to improving physician-based wellness metrics. The capital investment for this project will likely be in the range of $75,000. The potential return on investment is thought to be approximately 2 to 1 by the 3rd year of operations. There is also an opportunity to make money from the endeavor through partnerships with wearable technology and home RPM vendors. Based on your immediate reactions to the business case, I'm going to jump ahead and assume we've got your approval for the implementation of the TMA project, and that our charter is completed, and that I've been assigned as the project manager. Next, we'll need to focus on identifying the stakeholders. I've chosen these: the Chief Medical Officer, the Project Management Office Director, Project Manager, and then the project team, which consists of the IT personnel, clinical and administrative end users, and super users from within the project team. They will each play an important part in the success of this implementation. The CMO and PMOD will keep us on budget and report progress to you, the executive leadership team. The project manager will be responsible for tracking all the documents, the scope of work, any change requests, and inform the Chief Medical Officer and project team of the project's status, whether we're on track, on time, and on budget. The PM will also identify the project team. This team will consist of IT personnel who will create the application and end users from both clinical and administrative staff. From within the project team, the project manager will ask for volunteers to be super users from both the clinical and admin processes. These super users will be instrumental in the initial and continued training of the new workflows and processes and for the new hires post-go live. It's important that the super user be a volunteer as opposed to an appointed person. As studies have reflected, volunteers tend to have more success. Now let's talk a little bit about scope of work. The scope of work as defined by the Project Management Institute is all of the work and processes, and only those, needed to achieve the desired results or outcomes of the project. For the TMA project, we've written this statement of work. The Star Health Alliance Telehealth Monitoring Application Project will collect and integrate data from remote patient monitoring and wearable technologies into the clinical practice management system to support and improve physician-based metrics by a minimum of 20%. The specific scope of the project will be determined by the project team and reported back to the CMO and executive team once it's been developed. In general, that scope of work will include a timeline with milestones and deliverables or tasks that are already outlined. It will also include any limitations to the scope of work and specifically exclude work and processes that do not contribute to solving the problem or meeting our objectives. Thanks for taking the time to listen to me. I look forward to your feedback.